Hi, this is Dr. Dumestre, board certified plastic surgeon. Thank you for this question. So basically when you are deciding between getting a lift or an implant, you're looking for a little breast rejuvenation, there's a few factors to consider. So one, are you satisfied with the volume of your breast? You just wish that they were in a different position? Or do you really want to go up quite a bit in size as well as repositioning? Now, if you're close to the volume that you'd like, you can get a really nice result with a lift. Now, that being said, I do recommend doing a couple extra things when I'm just doing a lift to get longer lasting pop. So what I mean by that is, if I were to just do a lift, so just rearrange the breast tissue, that breast gland is heavy, it weighs on the bottom portion of the breast, and what happens over time when you look at the 6-month, 1-year post-op results, you notice that whereas initially there was quite a lot of roundness at the top of the breast, over time that flattens, you get most of that roundness at the bottom of the breast, and although you can get a nice result, it looks very natural, especially if you had quite a bit of droop to start. People often feel underwhelmed once they hit that 1-year post-surgery mark at the lack of volume at the top of the breast. So in order to counteract some of that force of the gland weighing on the bottom of the breast skin, what I like to do when we're doing a lift to achieve the most roundness at the top possible is to use a internal bra mesh, a sling that actually wraps around the breast gland, holds it into place, and then your skin just loosely drapes around over it so it's not bearing any of the weight of the breast gland as it's healing. And long term, that mesh, although it dissolves over a period of around 18 months, it leaves behind a layer of thicker collagen, providing longer lasting support. The second thing that I love to do when I'm doing a lift is to do some fat transfer. So that is liposuction to collect liquid fat. Often that can be from the chest sides, or if you're pretty thin there, just getting liposculpting of any other body part. And then instead of discarding that fat, repurposing it to inject into your skin, a little bit into the breast envelope, mostly for contour, but also can add about a half cup of volume in one sitting. I feel like with that, you can actually get a pretty close result to an implant. It's not going to be identical. So you can see this patient here, she had the lift procedure with the internal bra mesh, with fat transfer contouring, and she's 10 months out. So her result isn't going to shift a whole lot more. You can see here in this very non-supportive bikini, she's got great contour to her cleavage. She's got a lot of that upper breast pop, and she has no implant in place. Now, if you really want a lot of roundness up here, often you are going to need an implant to achieve that, or if you want to go up by more than a half cup size or so with just one surgery. So you can compare that to this patient who has breast implants in place. She's got a lot of that upper breast fullness, a lot of that roundness. So implants and lift play a very different role, but you can achieve really beautiful results with lift alone, and the benefit of that is no need for implant maintenance, no need to change them out over time. So that is a very useful purpose of the consult, to help you look through your options, kind of tell you the pros and cons of both, and help you come to a solution that works best for you. Hope that helps. Drop any questions you have in the comments.